Yes, so let's get started. First of all, welcome everybody to the Science and Research Workshop, Climate Solutions in Public Health. My name is Laura Iannotti, and I'm an associate professor at WashU, Washington University in St. Louis, and I'm also director of the E3 Nutrition Lab, one of the E's being most closely related to environmentally sustainable and climate solutions. We are together on Zoom today, unfortunately, not together in person. And I think it's a stark reminder of the impact of public health and what we're facing right now with the coronavirus, which no one in science has not attributed to climate change, but certainly we know that climate change is increasing infectious disease and vector-borne diseases and zoonotic diseases. So we are unfortunately reminded of that in this Zoom session. The objectives for the Science and Research Committee are, I want to remind you of those so we keep those in mind in this session, to synthesize what is already known about climate change impacts on solutions in the Midwest. So what's the evidence around climate change and public health? In particular, we're focusing on that. We are here to develop a research agenda focused on strategies that inform and accelerate climate mitigation and adaptation in the Midwest in the next 10 years. So as we discuss today, we really want to think about what is the purpose behind the research to find the truth and the nuance behind climate change and public health, and get behind the truth here. And then the final objective for the Science and Research Committee is to build a network of climate researchers across the Midwest to facilitate research collaborations, translation, and enhance the profile of Midwestern climate experts. So that's all of you. That is the network that we're building today. And you know, the organizers, I think, have done a superb job in structuring the summit around participation and hearing from you all as experts too. So we greatly welcome your active engagement in this workshop. As many of you know, the Midwest is facing all kinds of impacts related to public health arising from climate change. So diminished air quality, heat stress, compromised water quality, increased allergens, broken food production systems, vector-borne disease, as I mentioned before. These are just some of the ones that the EPA has been reporting on. So today we are very privileged to have with us 3 speakers who have expertise that are ranging on many of these topics, from nutrition to weather extremes, on communities and well-being, to policy action and legislative action for public health as it relates to climate change. That's another, I think, very distinguishing feature of the Climate Summit is it's sort of optimistic, let's focus on solutions. So I challenge you in this breakout session to think about solutions and come up with some creative ideas together. Finally, well, not finally, I want to say also thank you to the student facilitators who are an amazing group of individuals. I'm so impressed with them, their leadership at their age and what they have chosen to study. I get the chills even thinking about it. And then their passion around the environment. We're not going to do this without them. So thank you, student facilitators, for being with us and for leading these sessions. And then finally, we're honored to have the participants here with us. So thank you for joining. And again, please share your expertise and your thoughts. This is the whole point of these breakout sessions. So I'm supposed to give you a few Zoom lessons. I suspect everybody knows Zoom a little too well at this point, but I'll just highlight a few things. So if you would like to ask a question, first of all, we very much welcome you to join us by video. I know some people have connecting problems. We will take that as a sign that you don't want to participate and not call on you. However, if you want to just unmute and say something, please feel free, or share in the chat. Let's see, you can also raise your hand, give us reactions. I think the only thing you won't have as an option will be sharing your screen. That's reserved for the speakers, the student facilitators. So if you have any questions, please let us know. With that, I'm going to turn it over to each of our speakers. The way this session will run, we will do some introductions. They'll talk about their expertise. We'll have a little bit of time for Q&A with the larger group. And then Tony will adeptly and kindly put us into breakout rooms, and we will have the opportunity to have a dialogue with each other. So with that, I'm going to start with Lalitha and ask you to just give us some introduction. She's going to have a few slides, I think, to share about her experience in climate change and public health.
Thank you so much, Laura. I'm very excited to be here with all of you today. I am an internal medicine physician at the University of Minnesota. I'm also an assistant professor at the medical school. I primarily do most of my work with science communication and legislative advocacy. And I just put up some slides to illustrate my work, I think better in pictures. So, you know, as part of the hospital, we know that the healthcare system is a huge contributor to greenhouse gases, about 10% of US greenhouse gas annually. So we do have a health action program within our university. And the best part, I think, about working at the university is working with students. And Laura, like you were saying, I don't think we'll get this done without the enthusiasm and passion from students. So I'm faculty advisor for Health Students for a Healthy Climate, which is very unique in that it is an interprofessional group of students, both, you know, so we have health, dental, nursing, and all different fields coming together for interdisciplinary solutions. We have a very active residency program as well, who come out to our legislature and make sure that the people in power are hearing the science that we are learning in our classrooms. And this is another student who's part of the Public Health Advocacy Fellowship who's published a letter to the editor. And, you know, so a lot of my work is around legislative advocacy. I think we all know that the science on climate is settled. And Laura, as you were saying, we're already seeing a lot of health impacts within Minnesota and in our patients. And so when I see that, you know, a patient is coming in with an asthma attack or living in an urban heat island, I want to make sure that I use my health professional voice to let the legislators know. So I wanted to make sure I highlight that I can't do any of this work without having the support of community. So I want to highlight both the work of health professionals for a healthy climate. That's another interprofessional group in our state, and physicians for social responsibility. So I also wanted to use this slide as a time to think of different ideas. So, you know, being part of structures like this is a picture from our Department of Transportation, thinking about, you know, sustainability. I think more traditional ones like legislative testimony or speaking with the media, using your scientific expertise to put out white papers that will help guide legislators, town halls, and fun thing about advocacy and working with students is we get to come up with creative solutions. And so we organized a teach-in at the governor's office on the health harms of a pipeline that's being proposed. And I just wanted to close with the current work that I'm doing, which is working against an oil pipeline that is supposed to be built across northern Minnesota and working on getting out the vote. So thank you so much.
Couldn't be a more important time for that. So you have a speaker with research into action, most certainly. Lisa, or sorry, I guess it's Andy is next. It probably doesn't matter, but Andy.
Sure. Yeah, thanks, Laura, and thanks for the invitation to be here. It's nice to be with you all today. So my name is Andy Jones. I'm an assistant or an associate professor at the University of Michigan School of Public Health in the Department of Nutritional Sciences. My research and teaching background is in public health nutrition. I've worked for the past 15 years or so, largely in developing country context, looking at the ways in which smallholder agriculture, or the agriculture of farmers that manage small plots of land, how that kind of agriculture can have influence on the well-being of the families, the farming families themselves that manage that land, especially looking at the quality and diversity of their diets, but also looking at the ways in which young children are influenced by their environments in those settings, how early child feeding is influenced by that, how early child growth is influenced by smallholder agriculture. More recently, and I think in that work, I've been very interested in sort of how environmental influences shape nutrition and well-being, thinking about biodiversity as a prime example. And obviously climate change has had a lot of influence on our food systems and on biodiversity in particular, and it will continue to. More recently, I have been involved a little bit more directly in understanding the ways in which our food systems are shaping carbon emissions. This past year, I was part of a group of researchers at the University of Michigan that were working to understand the carbon footprint of our university here in Ann Arbor, Michigan. I was helping to lead a team of students and staff and faculty that were looking at the impact of food, our food system at Michigan in particular. There are different estimates, but globally, we think that agriculture and associated land use accounts for about 1/4 of all greenhouse gas emissions. A lot of that comes from things like deforestation, cutting down forests to make room for grazing cattle, for example, or growing soybeans in the Amazon. So in the U.S., that percentage is a little bit lower. It's estimated around 10% of emissions are from agriculture, but either way you slice it, there's a large contribution from our food system. And so we were looking here at University of Michigan at ways in which our dining facilities in particular were contributing to those emissions. And so we've been working with the dining hall directors and staff now for over the past year, and we're developing some proposals right now actually to actually test out some of the interventions that we think might be efficacious in reducing the carbon footprint of our dining halls. And you may or may not be surprised to know that a lot of it centers around the procurement and consumption of animal source products, so especially beef. Beef has a very high carbon footprint relative to even other animal source foods, but especially plant-based foods. Things like chicken and fish have a relatively low footprint relative to beef and other ruminant meat. So we're really focusing on red meat as a way that we can sort of pretty effectively and efficiently bring down emissions from food procurement and consumption. So there's a lot of interesting behavioral interventions out there that have been proposed for and tested for quite some time, more around looking at changing diets more towards healthy choices, healthy food choices. There's been relatively less looking at how consumers respond to incentives around carbon footprint or environmentally conscious food choices. So we're looking to explore some of those. They've often been called nudges in the research literature, or asymmetric interventions, thinking about, for example, changing the default food choice. So you have to, instead of having red meat as an option in the buffet line, you have to actually opt in, you have to ask for it, things like that. Very simple interventions that don't require, that aren't large incentives, and they don't require limiting choices, but they can actually have some impact on decision making, at least in some context. So that's something that I've been working on now for the past year or so. I'm a little bit newer to doing research explicitly looking at climate change, but it's been a part of my work now for the past 15 years or so, indirectly. And I think it is the single topic of our times, and I'm incredibly passionate about it, both in my personal life and now increasingly in my kind of research career. So I'm excited to speak with you all about it. I think in our breakout room, we'll be discussing a little bit about these issues around food choice and how that plays out and where there might be overlap between the carbon footprint of a food and its healthfulness for your diet, and where we can find some win-wins potentially. So I think I'll pause there.
Thank you, Andy, very much. That's a great example of the nuance we need to pay attention to and thinking about, and also the bidirectionality of food systems and climate change and how they affect each other. So thank you for that. Lisa.
Hello, everybody. I'm Lisa Reyes Mason. I'm an associate professor of social work, and I have been working on climate change, especially the social justice and social equity aspects of climate change and the climate crisis for about 12 years. I have my master's in social work and PhD from Washington University in St. Louis. And then I spent the last 7 years on faculty at the University of Tennessee, Knoxville College of Social Work. And just this summer, mid-pandemic, moved over to the University of Denver Graduate School of Social Work, which is where I am now. So my work really focuses on first on the disparities, on bringing attention to the injustice and unequal impacts of climate change on people, and especially how people who often have historically contributed the least to the problem of climate change are often disproportionately the most impacted by its severe consequences. And I do my work very much in partnership with nonprofits, with city offices across disciplines, especially across disciplines such as engineering and climatology, to work towards solutions. So some examples of my research in this area has included studies on the physical and mental health and financial impacts also of weather extremes on people, especially people who are living in lower income communities. And with this work in particular, the health impacts of weather extremes, there's a lot of work, related to heat waves, other extremes that draws primarily on hospital data, on the most severe health outcomes and crises that people experience, psychiatric admissions also. And where my work has been more on the ground, lived experiences, everyday health impacts that people are experiencing that might precede a health crisis. Or when you think about somebody who's experiencing poverty, how they might be having health consequences, health impacts, may not have the same access to insurance, access to care. It might put off seeking care because of other complex reasons in their lives. So that's why our teams have been looking at more of these everyday health impacts before the crises happen. Other areas of work have been access to information about severe storms, especially in particular tornado-producing storms that happen at night, and how to keep people safe from these nocturnal tornadoes. And then two other areas of work have related to weather extremes, related to flooding, related to rainfall, changing precipitation patterns and flooding. So I work with a very multidisciplinary team on smart stormwater technology as a solution for mitigating urban flooding. And the social science team, we look at what the public perception is of smart stormwater, not using the term smart stormwater because I didn't know what smart stormwater was until I started working on the project as well, and what social barriers to the technology might be. And then also expanding access to green infrastructure like community and household rain gardens. Again, especially in lower and moderate income communities where access to some of these kinds of green infrastructure are often less. So I'm a big believer, as you can probably tell already, that applied social sciences like social work, which have such strong values in community and engagement and justice, are valuable partners in tackling climate change. Because these solutions for climate change are partially technical, but not exclusively technical. They're also very much social. As you can already hear, I think, in our three examples, there's political will as an aspect, social relationships, structural inequalities. All of these are things we have to think about if we're really going to protect people and planet. And I really, from experience, believe that partnering with communities and through team science on this work can be really hard, but it's something that we can actually learn to do well with purpose and intent. And so those are some of the themes that will come up in our breakout room discussion, should you choose to go there. So back to you, Laura.
Thank you very much, Lisa. So she's really touched on a prevailing theme that has throughout the climate summit on environmental justice and sort of the disparities in how climate change affects different populations. That's certainly true for public health. So thank you, Lisa. And also the importance of team science and transdisciplinary work. You can just see by the panel coming from very different disciplines, but that does foster innovation and creativity, I think, in thinking through solutions. So we have a few minutes for Q&A. And I see there's one question in the chat. I'll go ahead and read that out. And if others want to add any other questions before we go into breakout sessions. So I would imagine this is for you, Andy. What do you think of lamb and goat farming contribution to the carbon footprint? Is it a good idea to encourage to have sheep and goat farming instead of cattle?
Well, lamb and beef have similar carbon footprints, and it arises from this phenomenon among ruminant animals, that they produce a lot of methane through the belches that they produce when they're grazing. And methane is a very potent greenhouse gas. It's not as long-lived as carbon, but it is more potent during the time that it is in the atmosphere. So that is one of the reasons why we see such large emissions factors from ruminant meat. But the issue of rearing animals is a complicated one, and it's not one that we can look at just from the lens of carbon, because there are as many as 1 billion smallholder pastoralists and agropastoralists around the world that manage animals as a very, very critical part of their livelihoods. And without those animals, there would be severe consequences for their economic state and their socioeconomic status. Even in systems where we're not talking about sort of smallholder, low-income management, animals are still play a really critical role in agroecosystems in terms of providing nutrients for soil, helping with nutrient cycling, pest management, things like that. So it's difficult to say exactly, where the solution is here. Certainly there are more sustainable ways of managing and rearing, especially cattle, than we see now, and doing it in a situation where you need to actually cut down large swaths of rainforest to do it is certainly much more damaging in terms of the climate impacts than it would be to rear it on pastures where it would be difficult to grow other crops anyway. So there's a number of variables to sort of think about there when talking about what might be a better solution. But overall, we know we need to decrease our consumption of beef, and there's some good information out there that if the highest income countries were to bring down their consumption by a certain percentage, we would be a long way towards addressing a big part of the problem. Not so that not all countries, not all individuals have to bear that burden, because in many low-income contexts, families aren't consuming enough animal source products to meet their nutrient needs. So it's a question of equity as well, and thinking about where to target these kind of solutions.
Yes, couldn't agree more, especially because that is the focus of my research as well. In thinking about, public health disparities globally, and who's getting the balance of consumption patterns. So let's see, we've got a couple more questions. Thanks to Andy for recognizing the other aspects of this problem, ecological, social, and economics. Let's see, do you recommend a vegetarian, vegan diet? I'm wondering about your perspective on nutrition vs carbon footprint aspect. Yes, so Andy, why don't we let you do that quickly, and then there's one for Lisa. I'll skip to Lisa just to kind of have some balance here.
I don't know. I'm not really in the business of recommending dietary patterns necessarily for individuals. It's a highly individualistic. That's a personal decision, I think, based on lots of things. A lot of folks simply are not able to manage that kind of a diet. In many contexts, like I was saying, diets are practically speaking vegetarian, not by choice, but because folks can't afford to purchase other kinds of animal protein. But certainly, like I said, decreasing the amount of, not necessarily all animal protein, but certain kinds of animal protein like beef could have a big influence on your overall carbon footprint. Certain kinds of dairy and cheeses can also have a big impact. So you can think about switching, making some modest changes, even declining the number of days per week that you're consuming certain kinds of animal protein. That can have a big impact on your overall carbon footprint from your diet. So you do not need to become a vegan to solve this problem, or even vegetarian. You can simply moderate the kinds of foods in your diet. And working with our dining facilities here in Michigan, it's a consumer-driven, it's a business model where they can't just unilaterally make changes that the students don't want. So removing all animal products is just a non-starter. So we're looking at ways that we can make some incremental shifts and move things in the right direction without making drastic changes in that way.
Laura, could I add a comment?
Of course, please do.
And Andy, you said you're not in the business of recommending diet changes. I think that's a huge part of my job, is talking to patients about diet and exercise. So I just wanted to highlight this other resource that I often use, which is Eat Lancet. So Lancet has a planetary health diet, and they talk about how it's good for your health and good for the planet. And we often focus on like those co-benefits. So just wanted to add that on.
Also, in recognition, I think of the inequities that, I think that the Lancet Eat Commission had some sort of targeted populations that they were, so we I think need to recognize that there are some populations that are not getting access to certain foods. Let's do one more question, maybe Lisa, for you, and then we'll have Tony send us into breakout rooms, because there's so much good stuff in the chat that I would like you guys to have an opportunity to talk in the breakout sessions. So Nicole, who I think was already an MSW student, has asked, are you seeing a shift in social work curriculum to include climate change and other environmental impacts?
Great, thank you. And hi, Nicole. Great to know that there's another social worker on here. Maybe there's others as well. Yes, absolutely. We're social work is definitely growing in this area. The Council on Social Work Education has environmental justice now incorporated into its competencies for all BSW and MSW programs. And since we have such a diverse audience here in terms of disciplines, I'm imagining this is a great audience where I love to kind of spread the word that in the public eye, often people think of social work as clinical, as therapists, or maybe working in child welfare or other social service agencies. And that's very true. It's a big part of what social work is. But there are a lot of us who are also working hard on issues related to community development, economic development. The Brown School at WashU, of course, has a long history in doing this work. And so the work on environmental justice and climate justice is just burgeoning in social work, because social work at the end of the day is a profession that's grounded in social justice. And so we see more is that in curriculum, there's more like one-off classes here and there, maybe an environmental justice elective that a student can take. Our school at University of Denver has a sustainable development concentration that students can choose, which is really exciting. And we're seeing also just growth in PhD students and early career faculty working on these issues. Again, just because I think folks are so drawn to the equity issues, of course, and then the values of community engagement and partnership. So it's a really exciting time in social work to try to work hard on such a difficult problem.
Really important time. So we are all going to break into breakout rooms, and then we'll come back, we'll reconvene at the very end and just hear a synopsis of each of the breakout rooms. So Tony will, I hope, send us on our way. Some of you may be staying with me in the main session. Tony, will you let me know when most people are back, please?
They are coming back as we speak.
Wow, quickly. Everyone here?
Everyone's here.
Okay, great. So we have very little time left, and what we'd like to do is just have each of the student facilitators give us a short summary of their breakout session, and then we'll bring this to a close. Matthew, would you like to start, and then we'll go through each of the breakout sessions?
Sure. So in our breakout, we sort of started off talking about agriculture and the KFOs, these big industrial farms that are harming these small communities and creating problems that are like exacerbating already existing problems related to climate change in these communities. And a big point of our discussion was kind of looking at climate advocacy or making change from a bottom-up perspective, starting with these affected communities, sort of addressing the problems there and then working towards a broader scale. That was a big topic of discussion because a lot of these people of color communities are concerned with gentrification, and once these green infrastructures implemented, if they're going to be able to afford to live there. So I feel like that needs to be addressed more. And there are a lot of justifiable trust issues between researchers, officials, and these people of color communities from just things that have happened in the past. I feel like these need to be bridged or at least addressed more openly. And we sort of closed it with kind of a call. We were interested in seeing if there's any more research in these sort of biome or regional diets that are more specific to where you live and how to be more sustainable in what you eat based on where you lived.
Thank you, Matthew. Marcus J., would you like to go next?
Sure, I'd love to. So in our group, we talked about a couple of different things, but specifically how your voice and advocacy can be magnified and how you can connect diversity and results from a field, a wide array of different fields to legislators and people that are able to affect change, perhaps on a community level or in a way stepping off of any sort of research that you do in a university setting, trying to connect that and give it another voice. Another large issue was surveying and social sciences and being respectful to the people that you're sort of dealing with and making good usage of information. You can collect a lot of data, but specifically how can you turn that into useful insights to start making change in a wide variety of different areas. We also talked about healthcare and its implications, especially with the pandemic, on sustainability, especially in reference to that 10% number of greenhouse gases being attributed to the healthcare sector. A large portion of that is supposedly from the operating floor, but also the single-use plastics and things like that that are part of drug fabrication and that sort of a process.
Wow, taking it in a different direction. That's fantastic. Gabrielle, would you like to?
Yes, of course. So we started off our conversation really about food choices and their different carbon footprints. We talked about how eating local is important, but also 60 to 80% of emissions do come from the actual production of the food. So we stressed talking about thinking of the supply side and the demand side interventions that you have of reducing emissions from our food system. We also talked about how plant-based diets can be a healthier overlap of climate mitigation and your own personal health. In addition, we spent a lot of our time talking about the documentary called Kiss the Ground. I'm not sure if any of you here have seen it, but it talked about the need to change our traditional farming methods and incentives that can be provided to these small town farmers to change their ways. And we really talked about the impact of inorganic fertilizers and the nitrogen levels that are in the soil. We ended talking about how there's really no simple answer to this problem, of course, and how we need to focus on small incremental steps. And one thing that we ended on that I thought was really interesting was the cultural barriers of food and that change, and how some foods, especially meats, can be of importance to family and religious traditions, and how this can provide a barrier for large changes for certain cultures.
Wonderful. You covered quite a lot. Marie, you want to finish this up for us?
Sure. So we started off by mentioning extreme climate changes and how that affected different areas in the world, which led to a discussion about how these climate impacts became like a ripple effect for agricultural communities, financial issues, and household issues. So we actually exchanged some resources and websites that we thought were helpful to our discussion within our group. We ended our discussion by one of our participants bringing up an issue in Missouri about how utility companies really didn't care about greenhouse gases, carbon footprints, and leading to public health. So we discussed partnership ideas and how as a community we can help each other.
Great. Any others want to weigh in the last couple of minutes? Okay, I certainly saw common themes across the different breakout sessions. We'll be bringing these to the organizers. And as one of our group members asked, what happens next? I'm not entirely sure, but I think they bring all of that together into a report, and it comes out in the Spring Climate Summit. So I encourage all of the participants to continue to participate in the science and research sessions, and also to join us in the spring for the Climate Summit in the spring. So a big thank you to the speakers and to the student facilitators. And thank you very much also to the participants who were on this call. We appreciate that you took the time and the energy that it requires to participate. So thank you, and everybody have a good weekend. Stay safe and well, and let's protect public health and the climate and the environment. Bye.